These are the results. This we don't do it anymore.
ये तो करते हो तो थोड़ा होल्ड कर.
Yes. And these are the defect, how depressed it is. It's pushing your heart. And this is the technique I'm talking about. The bar goes here. This is the bar inside in X-ray. This is the procedure. This is how we do it. And this is how it goes under the sternum. And then you get the results as you desire, like this. This has 2 bars. See, there are 2 bars. And these are the great results. And then I was trying to show you about the braces after these things. So these are the patients who have bulges here. You wear a brace and this is all gone. You got a bulge after the brace. Before, after. See, that's almost like Salman Khan. Before, after. Before, after. Before, after. Thank you, Dr. Malhotra, for inviting me today. My name is Shyam Kalvekar, one of the cardiothoracic surgeons from London, UK. I do various heart and lungs and thoracic surgery. I came here as an invited faculty for an international meeting, talking about chest wall surgery in all age group, from children to adult. And after coming to India, I realized that the treatment for this defect is very limited or none at all. There are patients keep communicating with me about their problems, and most of these patients are left on their own to find a treatment. The disease which I talk about, which is not a disease, it's just you're born with it, is whether you have a sunken chest, or it is called funnel chest, or there is something called pigeon chest, where chest wall is bent forward and people are very scared of taking out their shirt so that their friends will tease them. And it has been, the patients have been suffering in silence with them. We have a treatment for it, surgically and non-surgical, to make your chest look normal. It does also affect your chest, your breathing and your pain and posture. That all can be corrected. And so don't be shy, come back to us and we will have treatment for you. Thank you.
I wanted to ask you a few questions. That is, what is the status of chest wall deformity in India as such?
I think the chest wall deformity is not even diagnosed in a way, because person has to go to a doctor to say that I have a problem, and often is get ignored. I occasionally get a letter, email, or even a text from my colleagues saying that they have this patient, what to do. There are few sporadic treatment plan goes on, but overall there is no treatment whatsoever. Okay. In children, some people are treating it, but if you are adolescents, people who are teenagers, very little treatment available.
Okay. And where do you think, where in India, where can the treatment be got?
I think at present the treatment is not available, as I said, but we're going to start a Pectus India clinic, where we will see the patients in a clinic and they can be treated at either Apollo Hospital or Reliance Hospital in Mumbai. Eventually we will have a plan to do it in different major cities like Delhi or Chennai, so that people can access the treatment there.
That is true. I mean, the awareness of this condition has to be increased in India. And you mentioned something about the braces, I think.
Yeah.
And so where do you get the braces, and how can a person go about it?
Okay, pigeon chest is where previously we used to treat with surgery, where you had a big incision and cutting, taking cartilage off or this thing. But you don't need a surgery now. If you're under sort of 20, you can have these braces, which is like a braces to your teeth, but on the chest you wear it up to a 9 month to a year, and your chest is, the protrusion disappears and chest becomes normal. These braces at present only available in UK and USA, and they manufacture there. There are no braces in India for these patients. They keep asking me on this thing. I have managed to start giving them braces. Okay. We do Skype consultations, and then we do measurements and get the braces, but eventually the braces will be freely available for people with pigeon chest in India.
So we are hoping that some things should be available in India, because that is a need of the Indian people, I mean, who really don't have any awareness. And as you said, that they live with the deformity, and I mean, if they really come to know about it, it will be a great boon for their self-confidence, which we always liked, that the Indian people should be confident about everything. And so what about what is the future of the treatment for pectus, as you said? What more would you like to say?
I think the treatment-wise, there are two kinds of treatment. If you got a funnel chest, there's a surgery we do through the keyhole and put a metal bar which pushes your sternum forward and makes straight chest looks absolutely fine. You have to stay in a hospital for a couple of days, but then it makes your straight look so good that they could be on the Bollywood, giving Bollywood dances. But the other treatment, which is called pigeon chest, or where there is a pectus carinatum, where we use braces. Braces will help it to reduce it. You just have to wear it. It costs money, but once it's invested, you will have a normal chest or good-looking chest better than what you started with.
Okay. And would you like to show something?
Yes, I think this is what I was showing about pectus excavatum, which is where you see there is a depression there, and these are the one. They can cause problem. They can have a heart problem. You get palpitations. They can have a breathing problem, posture and pain. We can correct them. There are previously surgery was like that, but now we do keyhole. See, the scars are barely seeing there, and you see the chest is totally corrected. And this surgery is a bit more complex, where we do the keyhole. I can show you some pictures of it, which is this is how the keyhole is done. There is a bar going underneath your chest, and then it keeps it apart. This is like an X-ray showing you how the bar looks. It's not a sword pushed in your chest by some bhai, but this is actually treatment. And then this is how it goes, and then this is how the treatment. But there is other thing which I wanted to show you about this is the braces. The chest deformities are like that. See how protrusion here? The red mark is a protrusion, and then you put braces on. These are the braces, and then it corrects it totally well. See how protrusion gone back. Yeah. Protrusion going back. So these are actually there, and these are all 99% compliances. If you wear a braces, your protrusion will disappear. If you don't wear braces, that will stay there wherever. But there is a treatment. It's not very costly. It's reasonably priced, and it is available for everyone. I want every person who has this problem should easily access treatment in India itself, starting with Mumbai, but we can do in different places. I have experience for the last 10 years, and I've been treating people across the globe, and I just want to offer to India, which is my motherland.
Thank you, Dr. Kolvekar, and it was really the detailed description of everything, and I hope a lot of people who see this come forward to you, and people get treated, and as you said, they are ready to get into the Bollywood.
Definitely.
Thank you so much.
Dr. Malhotra, thank you very much.
Thank you.